Welcome to another episode of Love Living Local 315. We are your hosts, Scott and Kelly Greats, and today we are excited to welcome Dr. Victor Martinez Zavala. He's a plastic surgeon, reconstructive surgeon at Slocum-Dickson Medical Group, bringing a global journey from Mexico to Chicago to New Hartford. With a passion rooted in science, precision, and compassion, he believes plastic surgery is about more than procedures. It's about restoring confidence, function, and quality of life. Dr. Zavala, welcome to the show.
Thank you so much for having me. I'm excited to be here.
Yeah, let's, the journey's awesome, right? Born and raised in Mexico.
That's right.
Trained in Chicago.
Right.
And you're in New Hartford.
Yeah.
So what has that journey meant to you, both personally and professionally?
Yeah, I mean, it's been a long time, almost 20 years since I started medical school. I actually went into medical school with one of my best friends, not knowing we both wanted to be plastic surgeons. He ended up being an ophthalmologist. Went into medical school. I didn't know if I was going to like it. I was more inclined to do in architecture. And so we went in and ended up being first and second places in our class, him and me. And
who was first?
I was first.
Yeah, there you go.
yeah. But so ended up being there and realizing that's what we loved and what I loved. And so I knew I wanted to do plastic surgery, and I knew I wanted to train at the forefront. And so I actually did all of my medical school books and everything. I did medical school in Mexico, but I did all my books and everything in English, trying to, prepare for the future to come here. And so I ended up doing that. Then I came here to do the board exams. I spent a couple of years in Phoenix with a plastic surgeon down there while I was doing my board exams and everything, and then ended up in Chicago, initially as a general surgery resident. And I don't know if you guys know, but the journey in medicine for an international graduate that's not an American graduate is a little bit harder, especially to go into a very competitive field like surgery or general surgery or plastic surgery. And so I ended up taking 1 year of a preliminary spot in Chicago for general surgery. And then they liked me, and they're like, yeah, we want to take you. So I ended up doing my entire general surgery residency there for 6 years, and then ended up staying at the same place for plastic surgery.
In the form you sent us, you grew up surrounded by doctors.
That's right.
Was there a defining moment where you knew medicine or plastics wanted to be your specialty?
Yeah, there was. So, my great-grandfather was a doctor, my grandfather was a doctor, and then a bunch of uncles. My parents aren't doctors, but there was one moment when a good cousin of mine, one of my favorite cousins when I was growing up, he's older than me, he was showing me pictures of cleft palate and stuff like that for kids, and that's when I saw like the dramatic transformation, and I was like, oh, I think I want to do this. So, it was kind of that moment when I decided I wanted to do plastic surgery.
Difficult was it? So obviously your native language is Spanish,
Right.
Do you learn English as you're growing up, or is that something you took upon yourself?
So I always wanted to learn English because it was, the language. If you wanted to be someone in life when growing up, you needed to speak English, right? And so I always had opportunities growing up to learn the language. I used to have family in Canada, in Ottawa, and I used to go there for the summers to learn the language. I actually remember it very clearly when I went for my first summer there. I was about 8 or 9 years old, and I didn't speak a single drop of English, and then I came back speaking English. So,
Wow.
Yeah.
Yeah, that's
He's just gifted.
Graduated Thomas class. I think we went over that.
I took
already.
Spanish for 3 years. I know 7 words. So
Yeah. Well, it's
clearly a
hard.
smart guy here.
I think to learn a language, you really have to live it.
Yeah.
Yeah, and when I was in high school, I went to Italy to live a few months, and English and Spanish are so different, but Spanish and Italian are so similar. So I went there and learned Italian too, and it was you just have to live it,
So you often say plastic surgery is about restoring balance, confidence, and quality of life. What does that look like for in real life for your patients?
Right. In simple terms, is a lot of the patients that I see, especially for reconstructive surgery, have been in this long journey of recovery. Right. They go through cancer surgery. They go through fracture surgery. They go through so much, and I'm seeing them at the end of their journey. Right. I'm seeing them when they're getting ready to get back to life.
Complete again.
Right, exactly.
Yeah.
And so they're just missing that part, right? The reconstruction. And so I see patients. I recently saw a patient that was in the hospital for 6 months. They couldn't get him out because he kept getting infections. And so he needed just reconstruction because he had an open wound and he needed to be reconstructed, but there was no one to do it. And so he spent 6 months in the hospital just, in and out. And then I saw him and I fixed him and he's out of the hospital and living his life again. And it's just, restoring life. It's they can fix the fracture, they can do a lot of other stuff, but until you fix that last step, they can't really go back to their life, right?
Yeah.
Or even women, like especially with breast surgery and the strides that we've made in breast cancer, that a lot of women are being tested for that gene,
right,
and opting to have double mastectomies instead just for the safety of it.
Right.
So I mean, it's huge.
It's huge. Yeah, I see a lot of patients with breast cancer, and it's important to have someone that does reconstruction locally, because a lot of these patients are getting the mastectomy or the cancer portion of the operation, but they don't get the reconstruction, right? And so they have to go through so many more surgeries where we could just have done it in one stage at the same time as they do the mastectomy.
Yep.
At the risk of getting too deep into political or insurance, rabbit holes here. Yeah. Is this an option for everyone? So you mentioned like the gentleman that was in the hospital and he needed your services.
Right.
Is that an option for everyone, or is it really dependent on the type of insurance you have or how much money you have?
Yeah, I mean, it's an option for everybody. We don't really care about insurances, right? I'm not even on call at the hospital, but certain doctors at the hospital call me for consults because there's no one else that does it. And so the doctor that called me was an orthopedic surgeon at the hospital. He's like, "Hey, I've been dealing with this guy for so long and nobody else wants to see him or can see him. Mm-hmm. Can you please see him?" And I'm happy to see it. There's really no we don't discriminate in that sense where, if they need our services, we can provide them.
This is one side of what you provide is the reconstruction surgery, and we'll get into the Mohs reconstruction, which I did some reading on, and I had no idea that was even a thing. So maybe if we want to go there first before we get into the aesthetic portion of it.
That's good. Yeah, we can do that. So, skin cancer is so prevalent in this area.
Prevalent right now.
It's so crazy. I think that's like about 50% of my practice right now because there's so much. And I work at Slocum where there's a bunch of dermatologists, and so I have a big feeder for all of these patients. But then the main problem with Mohs is there's no one that does it locally, right? And so they have to go to Syracuse to get the excision or the cancer surgery, and then they come back to me, and I do the reconstruction. And it's good because even though they have to come back and they have to drive up to Syracuse, at least they don't have to, establish all the care over there and the follow-ups and everything. So it's pretty good.
Yeah, and so I can speak from experience with this that like I myself and my children, we see a dermatologist once a year.
That's right.
And have our moles checked out. And my daughter just went through the process where she had to have one removed. We had to go to Syracuse. So we had to come back. So I mean, I think a lot of people are taking better care of their skin now.
That's right.
And catching it early. So it's super important.
It's very important, and the fact that, we have a Mohs surgeon, at least in Syracuse, and we have that capability of doing the reconstruction here is also huge for a lot of our patients that, can't spend the entire, months and follow up and everything, driving back and forth, right?
So why is that? If as a business person, I look at opportunities and I'm like, if there's no one who can help these people here, why doesn't someone come here to help these people?
It is tedious. Like they remove layers of skin. It's
Right.
like, and it takes hours. Like
It
I did
takes
some
hours,
research
yeah.
on this.
So it's kind of like it's not just one person coming in and doing it, right? You need a setup. You need a lab where they take it out, and then you need people to fix the specimen and then look at it under a microscope. So you actually need kind of like a big setup to do it. And I think most of the people that are doing it, they're so busy in other areas that they haven't thought about it. But yeah, I think it would be a good business opportunity, as you say.
For somebody, for sure. So now let's get into the aesthetic surgery. This has become so popular, and
it's so big.
And so world influences, especially by social media. That's why we're here right now. Social media is huge.
Yeah.
How do you help patients set a realistic expectation? I think that's huge.
It's huge, and that's the biggest part of my job as a plastic surgeon, right? Because people will come and tell you what they've seen on social media, and
or
they
show
have
you
such
pictures or,
right,
yeah.
and they're like, I want to look like this, and it's very hard. You have to set very realistic expectations, and have to tell them what's reasonable and what's not reasonable, and that's a big part of the job. I think social media has done a lot of that, like setting unrealistic expectations. And so it's very important as plastic surgeons to try to, guide them in the right direction and tell them what to expect and what not to expect.
And for women, though, I've got to say, I'm not going to the total like opposite end of this, but for some women to have that confidence that they need, it may just be a minor thing, whether it's their lips or, wrinkles, the Botox, like it.
Right.
It could help complete your self-image. And it's so important that if that's what you need to feel good about yourself, why wouldn't you do it? I don't know.
Right.
I go back and forth with it. Yeah.
Yeah, no, I agree. I mean, that's what I do every day. And so, it's hard because a lot of plastic surgeons will tell you what you need instead of listening to you and listening to your main concerns. And I think that's the biggest part of like trying to connect with the patient, right? I see a lot of people that come to me after seeing other plastic surgeons, and they're like, I went in for like my chin or my neck, and they were trying to do my eyelids and my face, and I'm like, yeah, I just listen to what you want to do, and then we can take it from there, and I can tell you how we can enhance it, right, and how we can make it better. Not try to change you completely.
Exactly.
That's the thing. A lot of plastic surgeons, they have their own vision of what beauty is instead of what you think beauty is, right? And so they'll try to sell that to you.
Or once you do one thing, then you feel like you need to fix another. It's like an addiction thing. That like, I had this done and now I want this done. And it's like,
so how often are you talking people? I shouldn't say talking people out of things, but talking people out of things.
That's a big thing too. Especially with a lot of people that smoke or that have other medical problems, we try to not do more harm than good. And so a lot of the times is trying to talk them out or try to talk them down to a least invasive procedure. Sometimes we can't, right? Sometimes
they know
obviously,
what they want,
exactly, they know what they want. Yeah, and we'll just say, well, I can't do that. Right. But that's a lot of.
Yeah, good for you.
A lot of what happens.
And to Kelly's point, we see extreme examples through like Hollywood, but
right.
But some people chase that. It becomes a drug, for lack of a better. I mean, it's like once they do one thing, they need to do another and another, and before you know it, it's
that's
like
right.
we don't even recognize the person.
Yeah.
And one surgery that's very common is the post-pregnancy procedures that you do.
Oh yeah.
So that's a real thing. Like it's like, well, my body was one way before it went through this major, I grew a human.
Right.
And why shouldn't I be able to get back to where I feel comfortable with myself? So if you want to talk a little bit about that, we're not just talking about lip fillers and Botox and blasphemies and all that other
It's just
stuff.
like getting back to yourself,
Yes.
right? Before pregnancy, you were someone else. And then after pregnancy, obviously there's so many changes in the body that will never go back to normal unless we help it, right?
Right.
And so basically a mommy makeover consists of a tummy tuck or a body contouring procedure and a breast lift or a breast enhancement. There's so many different variations in that sense, but it's super important. I see a lot of people that they had kids, they feel back to normal. They're starting to work out again.
Right.
But they still can't get their body back, and that's
it's
something
depressing for women. I can tell you, like you go through those childbearing years, and your main purpose is, I want to have children. I want to be a mom. I want to. But then all of a sudden, these children, they grow up and they be independent, and you're like, well, what about me now? So that's why we get there.
It's the first time you actually start thinking about yourself, right?
Exactly.
Yeah, it's tough because we don't, you still feel young, but your body is different, right? Mm-hmm. Your body's not what it used to be. And so,
these minor things.
I'm not a doctor, but, skin stretches.
Yes.
Right? And as a man watching my wife go through this 3 times, it's the weirdest thing in the world, right? It's like you go from where she is not to this huge, and then it's gone. But then like the skin, so.
Yeah, you have the extra skin. You have the muscles don't go back to where they belong, right? The rectus muscles are supposed to be right in the midline of the abdomen, and then they stretch out, and then they never come back to normal.
But that's something you can do.
That's something we can do.
The mom makeover.
Yeah. And we also do it. Mentioning the skin, we're seeing a lot of the weight loss drugs, right? We're seeing a lot of that. So we're seeing a lot of extra skin, and those tend to be covered by insurance. It's very interesting because they have recurrent rashes and stuff under the skin, and so those tend to be covered by insurance. Obviously, they won't cover the full tummy tuck where we tighten the muscles and we give a nice shape, but the extra skin gets covered.
One area that people typically don't think of, most likely here, is hand surgery. So, another thing that you do in restoring people's ability to perform tasks. So in this digitally dominated world where so many people are on computers and using their hands, so I'm in the not the major medical, but property and casualty insurance space, and we do some disability, and a lot of people don't realize, eyes, necks, backs, hands are the major causes of work loss, right? So talk a little bit about what you do with the hands and tendons and how you help.
So everything in the hand, anything that's repetitive will cause issues in the hand, and so carpal tunnel, where the anything that involves a computer or anything like that, repetitive motions will cause nerve compressions in the hand. And so carpal tunnel, trigger fingers, anything in that sense, they're simple procedures, and we can usually take care of them either in the office or with a small procedure.
What are some things we talked about, skin cancer, we talked about carpal tunnel, we talked
breast
about
cancer.
Ergonomic. What are some things people can do, just quick hitting tips of like, hey, if you change this or break this habit, you're less likely to not to talk people out of needing services, right?
No, absolutely.
But what are some things people can adjust in their life?
So try to use ergonomics better, right? And so if they're doing repetitive motion, try to protect their joints. Try to protect. A lot of splinting at night really helps with carpal tunnel, especially for people that are starting to have just basically beginning of symptoms. They can do splinting at night, and it's been proven that it helps, just as much as splinting during the day. So if they just splint at night, then that can help. And then try to avoid the repetitive motions, which is hard, right? If it's part of your job, but a lot of the times that's part of it. Yeah.
All right. So you choose to practice in New Hartford. I do love this story. Let's spend a little bit of time on the community because I really did love the things that you said about the community and why it keeps you here. And so we're drastically different from Chicago, I'm sure.
Oh, my God. Yeah.
And where you grew up. Talk a little bit about Utica and why you've decided to stay here.
Yeah, it's just been great. My experience here has been great. Like every single patient that I see here, it's so appreciative of what we do. Everybody here is so nice, everybody's been friendly. Everybody's been inviting. It's been such a great experience. And so, plus, the option to come here and build something from scratch, right? To build something from zero instead of joining someone that, has already built it, that gives like an amazing gratification. And so.
Right. And just referrals too. We spend a lot of time on that once you establish yourself in the community, word of mouth and referrals are so important in a community like this rather than a bigger metropolitan community.
And, I don't think there's a better compliment than doing surgery on someone and then having them bring you their daughters or their parents or family members. It's like they trust you, and so they're bringing their loved ones, right? And so that's like, it's gratification.
It's a huge thing they're trusting you with is their face, their body, their,
How nerve-wracking is that for you? And obviously you're professionally been doing this a long time, but there's major stakes here, right?
There's
like if I mess up at
stakes,
work, no one's probably going to notice. But if you mess up, it's,
Right. Yeah, it's very stressful. I got to tell you, it's a lot of stress. It's a lot of stress. I wake up every night thinking about patients. I wake up every morning thinking about patients, thinking about ways, things can be done better. And I think that's part of the job, and that's part of like being a good doctor, right? Just thinking about, when you stop thinking about how to do better, that's when you start having more complications. And I'm not saying I don't have complications, right? Everybody will have complications. Mm-hmm. The only way to not have complications is to not operate, right? It's just the trick. But if you keep a constant mindset of how you can do better, and if you look retrospectively at how you've done and how you could improve things, I think that always helps you be a little bit better every time. And so
how do you manage stress personally? It's a big deal for you.
Yeah, it's hard. I'm a very quiet person, and I spend a lot of time in my mind and in my head. And sometimes it's hard because I wake up at 3 a.m. and just think about. But the best way that I've seen to handle stress is to write everything down. And, whatever's stressing me out, I'll write it down, and I'll write it, and I'll see, I'll try to write down the possible outcomes and the possible options to fix it. And that brings my stress level just, down to 0.
Great advice for everyone listening, by the way. That could be a little clip there, Jay. When you acknowledge something like that, you take its power away.
Right.
Something that is stressing you out or giving you fear, anxiety, to name it is to tame it. I stole that from someone. I don't know who. But you name it, and then you take the power away from it, so.
Everything. And it's not just about medicine, right? It's about everything in your life that could be stressing you out. If you write it down and write out what you can do to fix it. And if you can't do anything, then, that also takes it away, right?
Sure. So acknowledging that. Yeah, let's talk about another thing that I'm sure helps reduce stress, which is physical fitness.
Right.
You're clearly a fit man.
Yeah.
And this will go after. You'll have already participated in this when this gets released. But on March 6th, you're participating in the Treadmill Challenge for the American Heart Association. Why is that important to you?
Well, it's important because, especially for family, I have a 4-year-old daughter. You want to, 1, set the example, and 2, be there for them in a good way, right? You don't want to grow old and have them taking care of you. I think that's the major thing for me. Sure. I think it's important for me, my family, and then especially for my patients when I see, you can't sell something that you don't do. Especially, we're trying to sell fit bodies and all that, right? And so if it's like, walking into a dietitian, and the dietitian being like 400 pounds, right? You're going to be like, well,
don't take financial advice from broke people.
Yeah, exactly. Yeah.
So let's talk a little bit, spend a little bit of time with Slocum.
Right.
I love Slocum. All
it's
my
great.
Doctors are there.
It's great.
The network is great. Have they been wonderful?
It's been, I had some other work options before I come into Slocum, and it was a very hard decision for me to leave like a major city and a major metropolitan area to come to a small town. But the opportunity that was presented to me by Slocum and the way the group works is amazing.
The network is just awesome.
The network is amazing. I can get my patients cleared for surgery like the same day. I can have them. I can just call the primary care and be like, "Hey, can you please squeeze them in?" We talk amongst each other. It's like something you don't see in medicine anymore. You'll see a doctor and they'll refer you to a doctor, and they'll be like booking 3 months out, and they won't talk to each other, right? Here we talk to each other, and so we're like, when they have any concern, they call me and they're like, "Hey, what do you think about this?" it's like such a game changer when your doctor personally takes that and does that for you, because like, anywhere else they'll just be like, oh yeah, we'll send a referral and we'll see when they can fit you in,
and then
right?
they never speak to each other again.
Right.
Whereas just I know myself, like I see an endocrinologist there, my OB is there, my primary care is there, and I don't have to, when I see one of them, they have all coordinated with each other that they each know what is going on with me. And it's
amazing.
Huge.
It's huge.
The older that we get, we need that.
Yeah, you need that, because you need a group that has your back, and not someone where, you're going to be driving so far and not knowing who you're going to see and not knowing when you're going to see them again, right? At Slocum, this is such a great thing.
Yep.
The other thing that I like is we're all, like, between the doctors, we're friends, right? And so it's so much easier to communicate between friends than, in a formal setting. And so it's just amazing.
A great community.
It's a great community. And the business model for Slocum, there's nothing like that in the US. Everything's getting bought out by private equity. And so I think it's one of the only freestanding, private physician group out there. And I think, private equity is obviously trying to buy it, but, what happens when private equity, buys into medicine, and everything is about profit. And so, the quality of the care goes down. So hopefully that never happens.
It's a whole nother.
It's a whole nother topic there. Yeah.
We could talk about that for hours.
Going to the
We're
rat
not going to
hole,
go
right?
there.
Yeah.
What does success look like for you in 2026? By the time 27 hits and you look back on 26, you say, hey, it was a great year because I accomplished this.
I think, I've been at Slocum for 4 months, right? I think the major goal for me this year is to build a successful practice, a practice where I have happy patients when they come back and they bring their families, their friends, they come back and see me with a smile on their face. And I have a lot of those patients right now, but I obviously, I'm still building my practice. And so I think that's going to be the biggest thing for me this year.
Is there a certain area that you'd like to focus in on or build upon?
Yeah, I'm most interested in building my cosmetic practice, but I'm also interested in building the reconstructive aspect of it, because I know the community needs it, and so I want to build both at the same time. So yeah.
How do people find you?
That's a good question. There's a lot of marketing going on from Slocum. I know one of my patients, he's like, "Oh, I see you on TV all the time." And I go, that's my surgeon. That's the one that fixed my leg. But I think, just TV, internet is such a big thing right now. And so that's why we're here, right? Yeah. It's also very important.
And so I was just going to say, treatments like Botox and derma filler and not surgical procedures are so common that you have these shops where you can go in and who knows who is administering that to you. Whereas like to trust, like just I'm going to do a walk-in appointment and I'm just going to let this person like shoot in my head like this stuff.
Yeah.
Like, why would you not want to go see a doctor? I'm just telling you, like it's so common now.
Yeah, don't get me started.
It blows my mind.
No, get started.
The thing is my practice is, like, I'm not going to make money on Botox and fillers, right?
Right.
Like, I do it because my patients ask me.
Right.
But I don't want to be battling with, like, there's I don't know how many med spas if you look around, right? If you go online, there's like so many med spas. And they don't go through the same training, right? The same people that are injecting your face, they might take an online course that lasts, I don't know, a few months. They might, go and do hands-on experience for, a few times, but they don't know the anatomy the way they do we do. They don't know, how to manage the complications or when it's, a patient is purely surgical versus just non-surgical, right? I think that's the biggest thing. And so, I don't want to, have any beef with them, because obviously there's no competition, right? If I was only doing Botox and fillers, then, my practice is done, right? Because they're all established. And so, but I think it's a good idea to have them know their limitations and when something is surgical and so forth. Yeah.
All right. Well, quick 30 minutes.
I know.
Yeah. We end all these with some fun, lighthearted
Okay, great.
Rapid fire questions.
Perfect.
I added one to the list.
Oh,
I
you
love
did?
that.
Yeah. You wanted to start with that one?
Go ahead.
You lived in Chicago.
Right.
You've been here in central New York. Let's
Right.
talk about the pizza.
I never liked deep dish pizza.
Okay, there you
I was
go.
always-
Good answer.
take
Good
that,
answer.
Chicago.
I was always a New York style pizza. So
What's your
that's I
take
was
on the
very
tomato
happy.
pie? That's weird for a lot of people who aren't from here.
Yeah, I love it. I mean, I still like the New York style better.
Okay.
But yeah, it's it's the same as the deep dish. I was never a big fan of it. So
Fair enough.
yeah,
Okay, are you an early morning guy or a late night guy?
early morning. Yeah.
Most rewarding type of case that you do.
Anything pediatrics, anything with kids, it's amazing. You know, the way they handle it, the way they, for kids, they go through a different process, right? We can like think about stuff, but kids, they're amazing.
Let's stay there for a minute, right? Because I know this is rapid fire, but this is important.
Right.
My guess, and tell me if I'm right or wrong, the bulk of your work there is probably with the parents. Because I feel like the kids are just super resilient. They don't know what they don't know.
Exactly. But yeah, there's a lot of it that goes into the parents, especially by me being a parent. Like, you understand what they're going through. And so it's a lot of work with the parents. But also the kids. I mean, the kids, like you said, they're so resilient, but they're also so grateful and they're just like so great to work with. It's like, yeah, unparalleled.
Yeah. I would think his bedside manner is great. Like, you just want somebody that's going to be.
Yeah, for sure.
Yeah. One misconception about plastic surgery.
Well, I think, everybody hears plastic surgery and they're immediately think aesthetic surgery.
Right.
And we do so much more, right? We do so much more.
What's one skill every great surgeon must master?
Master their minds. Master their minds. It's hard. And I think, anybody, right? It's very easy to question, the way you do things and the way you tackle on things. And I think, what your mind tells you is not reality. And so you have to be very mindful of what your mind is telling you and what reality is. And if you master that, I think you can be one of the best surgeons out there.
Do you have a pre-surgery like routine to get yourself mentally prepared?
So yeah, I don't do pre-surgery routine per se, but I do play music in the OR every time. And I do prepare for every case. Even if I've done it 1,000 times, I still go the night before and read up on it and, read up on new techniques and stuff. I think that's my pre-surgery routine.
Now I need to know what music's playing.
Yeah, I don't know if you guys are gonna like this, but I like deep house for operating.
Okay.
That's great.
That.
I know, right? Okay, Mexico, Chicago, or New Hartford, best food scene.
This is too hard. Mexico City,
Yeah.
for sure. Yeah.
I think there's a childhood bias there, though.
There is, yeah. I mean,
tradition, the family.
I can eat tacos every single day of my life, and I'll be happy. And so it's hard to say, anything else.
It's an unfair question, but good job answering it. Some people would duck that one. Biggest lesson medicine has taught you?
You're treating human beings. You're not treating, you're not treating an entity. You're treating a person as a whole. And so if you look at medicine, and this is where medicine gets depersonalized, right? When people start thinking, oh, I got an appendix to do, or like a surgeon starts thinking, I got a gallbladder to do, right? You're taking out the gallbladder on a person, right? So when you start thinking about, I got this to do on this person, is so much more different. Like, I think that's the main lesson that I get from like even my grandfather, who was a surgeon.
One word that describes your approach to patient care.
I don't know, gentle and compassion, I think.
So funny, as you were thinking, I'm like, compassionate.
Yeah, he's compassionate. I know, right?
I'll answer this one.
Yeah.
Thank you. You know me already.
We're best friends.
40 minutes in, and you know me.
All right, last one. I think I know the answer to this one too. But when patients leave your office, what do you hope they feel?
I hope they feel happy, and I hope they feel supported, and that I have their backs. That's my main goal. So when I see patients, I hope they leave with a smile, and they leave with all their questions answered.
Dr. Victor Martinez Zavala, Slocum-Dickson Medical Group.
Thank you so much.
We'll make sure we link in the show notes where people can find you online.
Thank you so much. I appreciate
it. Kelly said it, bedside manner, and just, again, 40 minutes. We can tell you are the real deal as far as truly caring for your patients and doing this for the right reasons. So grateful we had this time, my friend.
Thank you so much. Thank you so much for having me.